If the busy holiday season made you or a loved one realize how much of the conversation you're missing, you're asking people to repeat things, now might be a good time to address your hearing loss. The audiology specialists at Lake Ear, Nose, Throat and Facial Plastic Surgery explain there's nothing to be afraid of when looking into hearing aids.
I think women are sometimes worried about the vanity. What's it going to look like? What are my friends going to think? I don't want anybody to know. But oddly enough, sometimes women are less vain than men because they want to hear better. And I always say, what's more embarrassing? To have someone see a hearing aid or to miss out on the conversation and have everybody sort of make fun of you because you didn't hear the punchline or the joke?
A lot of times it's a family member that sends the patient in, but if the patient's, honest with themselves, they'll notice that when they're in a group setting, they start to not include themselves in the conversations because they're not quite hearing everything and they don't want to be embarrassed by answering incorrectly, so they just kind of withdraw from the conversation. We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at. There's a variety of styles of hearing aids. There's ones that go behind the ear that have an ear mold that's made to fit your ear. And there's ones that just have a little tube in your ear. Those are called open fit hearing aids. By far, that's the most popular right now. There's ones that go in your ear and ones that go completely in your ear so they're invisible. You have a trial period of 30 days, so you take them home. You might come back in, we'll make some adjustments for you, try them again. If they're still not working, we'll move on to something else. We might try 2 or 3 different things before we figure out what works for you.
One of the differences of coming to Lake Ear, Nose, and Throat versus some other places that are dispensing or selling hearing aids is that we are more of a medically based approach. So we have physicians in our practice, audiologists and hearing aid specialists, all under one location. So we can truly look at the rehabilitative approach of what we need to do to determine if there's a medical problem, how to treat that problem, and then after we take care of that, how to rehabilitate you with a hearing aid.
You'll find contact information for Lake Ear, Nose, Throat and Facial Plastic Surgery when you follow the Hearing Help StoryLink icon on our homepage, yourhometownhealth.com.